demonstration class for lungs. Now first, you have to hold the lung in anatomical position, and before holding the anatomical position, you have to determine the site, and site of the lung is determined by holding the lung in anatomical position. Now the problem is you have to know some features to hold the viscera in anatomical position. See, this is the apex of the right lung. You have to make a first rib by curving your thumb and index finger. So this is the, just imagine this is the first rib. You have to place your hand like this. So area of the lung beyond the first rib is the apex. So apex is not a point but an area. Just opposite the apex lies a concave semiannular base. In case of right lung, it is more concave because of the presence of liver. It presents a sharp anterior border. This is a sharp anterior border and a rounded posterior border. So, this is the hilum of the lung. So, how to hold in anatomical position? The apex looks upward, base X is directed downwards. Anterior border, sharp and thin anterior border looks forward, rounded posterior border looks backward, and medial surface containing the hilum looks medial. So this is the right lung. You have to place the base of the right lung in your right palm. But when you are asked to show the apex, you have to change the hand. This is the apex of the lung. This is the apex of the lung. Now you have to trace the anterior border. It starts from the close to the apex. This is the sharp border. You have to trace up to the inferior border. You have to trace up to the inferior. This is the apex. Sorry, this is the apex and this is the inferior border. So you have to see that this is the anterior border of right lung. Similarly, this is the posterior border. Posterior border is rounded. Posterior border is like this, from apex up to the inferior border. And this posterior border is related to the heads of the upper 10 ribs. Inferior border, it is circumscribed border. You have to demonstrate the inferior border by this way. You have to move your finger and bring your finger to its original position. So, how to show the inferior border? You have to show the inferior border like this. So, you have to complete the circle. Now, come to the surface. It has two surfaces. One is medial surface, one is costal surface. The costal surface. Costal surface is related to the lateral thoracic wall, and it presents some impressions for the rib and costal cartilages. In between impressions, there are elevations. These elevations are formed by the intercostal spaces. The costal surface comes in relation to the upper 6 ribs in the mid-axillary line, and related to the upper 8 ribs in the mid-axillary line. This is the mid-clavicular line, this is the mid-axillary line, and upper 10 ribs are related to the scapular line. Again I repeat, the anteriorly the costal surface is related to the upper 6 ribs in the mid-clavicular line, related to the upper 8 ribs in the mid-axillary line, and related to the upper 10 ribs in the scapular line. Now the medial surface is again divided into two parts. The posterior flat part, this is the vertebral part of the medial surface, and this flat vertebral part of the medial surface is related to the bodies of the upper 10 thoracic vertebra with intervertebral disc. In front of the vertebral part, the rest of the medial surface is known as the mediastinal part. The mediastinal part presents a hilum and attachment of the pulmonary ligament. This is the hilum. Hilum. You have to remember the arrangement of structures, and it will be discussed in a separate video. Individually, you cannot identify. It's difficult, but you can identify the bronchus easily by palpation of the cartilages of the bronchus. Now, the right lung presents 3 lobes separated by 2 fissures. One is the oblique fissure. This is the oblique fissure. This is the oblique fissure. This is the horizontal fissure. So, it presents upper lobe, middle lobe and lower lobe. Now, you have to trace the oblique fissure of the right lung. It starts from the upper and posterior part of the hilum, passes upwards and backwards and curves the posterior border 2.5 centimeter lateral to the junction of the T3 and T4 spine. Then it turns forwards and downwards, and curves the inferior border. So, you have curves the inferior border at 6th costochondral junction 7.5 centimeter away from the midline. So, and then it turns to the medial surface and ends in the anterior and lower part of the hilum. So, this is the oblique fissure. Starts from this. Now, it curves the inferior border and comes in the mediastinal surface and ends in the lower and anterior part of the hilum. Horizontal fissure starts from the oblique fissure. The oblique fissure original starts from the mid-axillary line and passes almost horizontally and reaches up to the level of the fourth costal cartilage. So, these are the usual lobes, but you should not identify the site of the lung by the number of fissures and lobes, because number of lobes are quite variable. There may be upper azygous lobe above the hilum, maybe a lower azygous lobe below the hilum. Additionally, there may be a lobe of azygous vein. Azygous vein sometimes splits the apex into medial and lateral parts. So, medial part is known as the lobe of azygous vein. Now, you see, this is the medial border of the medial surface of the right lung. This is the hilum. That is the arch of azygous vein, and the other is the cardiac impression depressed and other related impressions. All impressions are not very clear. You have to imagine the visual by knowing the theory. That's all about the gross feature of the right lung.